help myself.
See if our answers change.
You
No,
know.
there's a camera.
So, how did this whole thing start in terms of when you realized, she wasn't developing, and what was it that made you go seek some help?
I think we initially sought some help when she, after she got sick. And it was just a virus that any typical kid would recover from, but she didn't quite bounce back as the doctors expected she would. And she started to lose skills fairly quickly after that. So I think that's how we knew.
Yeah, that kind of kick-started the whole thing. We had some suspicions earlier, but they were small developmental things. She wouldn't clap, she wouldn't point, she wouldn't wave. We saw that at like 10, 12, 14 months. But she would feed herself, she'd pull the stand, she'd grab a toy and actively play with it and try to eat it like, kids that age would.
Talk. Walk.
Yeah, so there were little things before, but the big thing was like 16 months when that virus hit. That really kick-started a whole whirlwind of regression and issues that we saw. So that was probably the hardest part of what started the whole thing.
And,
You all right?
and how long did it take to diagnose her?
It took a long time. Shortly after that virus, she was diagnosed with mitochondrial disease, which was a misdiagnosis. I think they jumped to a conclusion because she was not bouncing back from the illness, and they thought maybe it was just like a slower climb to get back to where she was. But then as things progressed and she continued to lose skills, it just wasn't fitting the mitochondrial disease that they thought it was. So they did more testing, and then our insurance didn't want to cover more testing.
Yeah.
So we had to go to another doctor, and he sort of did it through another lab that we were able to pay for. Like they had like a family payment plan, so that we almost paid for it out of pocket.
Yeah, it was pretty close.
And that's how they found the Tay Sachs disease mutations, which then prompted our other doctors to test us and confirm her diagnosis. So that didn't happen until December, January of last year.
So how long from the time you realized there were issues to the time you got the proper diagnosis?
Give or take a year and
A year and
to
a
15
couple
months.
Yeah.
And she was tested for a lot of other things prior, but we don't remember if because we were tested for Tay Sachs prior, if we told them not to test for it.
Right, in our carrier screenings.
Just because we already were tested for it. So she was tested for many other syndromes prior, which
We're ruled
were all
out.
negative and
Yeah.
ruled out. So that's kind of why I think the geneticist at that time just pushed mitochondrial, because there was some evidence that it could have been that.
Right.
But he
She had
didn't really
symptoms.
dig much deeper, so it was kind of, questionable.
With these developmental diseases, they tend to overlap a lot of symptoms, so I think it's not always very clear.
Yeah.
In I think our pregnancy screening, when I was pregnant with her, I threw off her diagnosis to begin with because I thought she couldn't have Tay Sachs. I didn't know that there was other screening methods that weren't performed correctly, in the process.
Yeah.
So when you found out, how'd you take it? How'd you feel? What'd you think?
I think
We didn't take it very well.
No, not at all. I think I was more perplexed on how that's possible. It has to be wrong. There's no way, they did something incorrect. We're going to get some other test done, and find something that has to be, to overturn what they found because it just couldn't be right. But the pieces fit, the symptoms made sense.
Right. And all that being said, we were already diagnosed with another terminal illness, so changing our mindset from the one to the other, as difficult as it was
just putting a different name on the same situation. Our daily life at home wouldn't change. What we did, day in and day out, didn't change. So it was just a different name to the same situation.
Right.
Just a little hard to get over the fact that we swore it couldn't be that.
Right.
So that really was the hardest part.
And did anyone say to you anything else about Tay Sachs? Like it could be, there's another strain, or like, I still am baffled by that whole story.
I think I am still baffled by that. That the carrier screenings that they do for pregnant women and their families are not all inclusive of the whole gene, that they're only testing for these specific mutations. And it's not just us, there's other families that this happened to. It seems like, I don't know, they're just really missing the mark on the carrier screening. I think it's really horrible.
Yeah.
So
Well, our
many-
insurances don't cover it either.
And so many families are now,
You know,
more and more families are affected this way, or they don't get the right diagnosis maybe ever, because they're,
Yeah.
if you don't have this information, you wouldn't know. Like, I didn't know when I was pregnant that there was more than one test. I didn't know that.
No idea.
So, it's frustrating.
When you took the pregnancy test, did you do an amnio?
No.
Did you do, so how did you find out you were a Tay Sachs carrier? You said along the way, right?
Yeah, so I think a couple weeks or months into your pregnancy, they just do screenings. It was just blood work that they did, and she just found it. She found the
Yeah, they
The
same
genetic-
test they do for like Down syndrome, and I don't know what else.
I don't know. I
for
think they
MS and
screen
something
for a
else,
couple
maybe.
different diseases like halfway through
Yeah.
your pregnancy. So since mine is on that standard panel, mine was found quickly. It was just found on that panel.
Yeah.
So our doctor said that not to worry, that we would test Brian, and that if Brian was negative,
Everything would be fine.
be nothing to worry about. And if he was positive, we would run more tests on the baby. Like we would do the amnio. So I pretended to not be freaked out, and we
were
waited for
freaked
his
out,
results.
but we
Yeah.
were freaked out, but
And his results came back negative. So we thought,
dodged the
here we
bullet.
have this perfect,
Yeah.
healthy baby.
Everything
And
was
when
good.
she was born, she seemed like a perfect, healthy baby.
Yeah,
So
she was.
here we are.
At what point did you find out, or how did they explain to you that there's like another strain of this that's not tested for?
Well, at the new lab that we went to get her diagnosis, when they sent us the paperwork, or the doctor presented us with this paperwork, I think our first questions were obviously that we were already tested for this, that like how come this wasn't caught on the prenatal screenings, and he sort of, it's all a blur that day, but I'm pretty sure he was a neurologist, so he
Yeah.
deferred us to genetics, and that's when they tried to explain to us how
There wasn't.
these things could be missed,
Yeah,
I
it's-
guess.
No test is perfect, they say. And if they're really digging, they can do an enzyme test, which is really the test they should do, which actually tests the function of that protein. What the actual what am I thinking of? The
Enzyme.
enzyme does. So that's really what they should have done, but they didn't because they didn't think it'd be necessary. Mostly, I think too, it's not known to be more than just a Jewish disease. It's kind of just straight thinking that it's either that or they also say sometimes French Canadian or Cajun, and that's pretty much the demographic they give it. They don't really give it more than that. So, and its rarity, especially these days, it's kind of overlooked. So you do the basic test, and they say, okay, everything's fine.
Right, with the assumption
and
that
probably
it's
99% of the time, it would be.
Mm-hmm.
It probably would be fine. So,
Not in this case.
that few percent that's out there,
right,
the more you know.
right. You okay?
What advice do you have for another family who may have Tay Sachs or a related similar disease?
My advice would be to connect with the other families. I was resistant to do that at first.
Yeah.
I don't know why. I think I didn't want it to be a reality, you know? And they always say that, you know, it's the best family that you never wanted to be part of. And it is true. They help us a lot, just in so many ways, emotionally, and also, you know, how we care for her. They're better experts than any doctors most of the time. So
They also help with things that aren't necessarily medical, but they are like trying to get Medicaid, getting therapy services, what worked, what didn't. So it's not only like the day in and day out care, you know, but it's the little things that you might forget about, you know, that you struggle with and fight with, that they have advice or something they can do or give to kind of help you out as well.
they definitely helped us to feel more prepared on how to care for her.
Absolutely.
So we're not usually caught off guard.
Yeah, take every one day at a time. One day's going to be hard, next day could be good. You know, and it's back and forth every day, and enjoy the good days. Remember them, you know. And just don't take anything for granted.
That's good advice. Do you guys ever like leave her home with your mom or somebody else, or do you
We
feel
do.
like you can-
Occasionally
Yeah.
we leave her with
Yeah, we do.
usually my mom or Brian's sister.
Yeah, I mean, less these days than we used to. But we do. Yeah, a couple hours here and there, just to get some time out, time with friends, time alone, whatever it might be. Of course, you worry the entire time, but I think every parent does. So that's you know, a normal symptom.
I don't think that's
or feeling.
specifically Tay Sachs.
Yeah.
Yeah. Usually we're able to just bring her along wherever we are.
Yeah, we often do that. Just take her anywhere we go.
She likes to get
She
out.
doesn't bother
She likes to
anybody.
get out. Yeah. See the world a little bit.
Yeah.
More than our living room, you know?
Do you guys ever think like, why did this happen to us?
We used to often. Yeah.
I think we still do probably fairly
A
often.
little less. I think it comes in waves. You know, at first it's all you think about, right? Then after a few months you think about it a couple times a week. And I think it kind of comes and goes. You know, and you really don't have an answer, and you never will, right? You can never get an actual answer to that question, so.
Right.
But it still pops into our minds often. You know, why were we given this miracle of a terrible situation, you know? So it's kind of hard to talk about. It's like a double-edged sword when you talk about it, 'cause it's kind of like,
Yeah, because it's so horrible,
yeah,
but it's also,
who she
I
is.
don't know,
So you
yeah,
can't-
like she's so great, so it's hard to say, like,
Yeah.
you know.
Yeah.
Oh.
Bless you.
Okay.
And as far as your family and friends go, do you feel like they have any idea what you're going through? Do they understand it? Do you feel like, isolated
On a
in a
small
way in
scale.
that sense?
Well, on a small scale, they kind of understand.
I think they do, and if
Glimpses
they don't,
they
I think
see.
they try to,
Yeah.
you know? I mean,
I don't know if they understand at 3, 4, 5 in the morning, but they understand when they're here, a little bit, I think. But you can't. Obviously, they cannot understand entirely. And I don't think anybody can except those who go through the same thing you go through. I think that works in a lot of different situations, but which again is why the conference and the people who are involved with it and the NTSAD and CTSF people are just absolutely amazing to connect with and be a part of. They know diagnosis day, they know
right, a day that you
The
just
worst
need to
days ahead.
vent and things aren't going great. they get that, you know. So,
They get bad days. They get good
but I
days.
think our family and friends are pretty great.
Yeah.
I think you guys are pretty great.
Well, thank you.
Thank you.
Is there anything we want to add, Jude?
I had a question before I got there.
Okay. We're going to let you go back to your life.
Well, thank you.
Glad you guys came home.
Yeah.
Thank you for having us and sharing your story. And
I'm
being a
excited
part of
for
this.
some contribute some awareness to this
Yeah,
because I just feel that
There's not enough noise
like-
about it. There's not enough awareness about
and
it.
like we could have a treatment for these kids or something, but there's just not enough money and there's not enough awareness.
Yeah, I
And
mean,
it's hard to keep the momentum going. I think with the fundraising and the money and the lab work and all, you know, with all these doctors, there are a lot of people trying to help these kids, but they just don't have the funds to do it. And
one of the biggest fighters is the Tay Sachs Foundation. They're out of Cleveland, Ohio. Ken Ben started it when his daughter Dakota was diagnosed. He's been running it since 2007. Him and his board and all the people have been pushing really hard. Now that they're getting close to something, they're starting to run out of money. So it's a little bit of a concern in the future of having enough funds to support.
and it's frustrating to know that we're so close to treatments,
Yeah.
but
Yeah,
it's not
to
ready.
get it through clinical trials within 2017 will be a challenge.
And these kids don't have that kind of time.
Yeah, so that's our main goal, is to try to raise as much money and awareness as we can to keep that organization running and being able to distribute, through the different channels and different trials and research that he can. So that's our goal,
Yeah,
right?
Sounds like a
BFF
plan.
Cam?
yeah. And we keep her as healthy as we can and in hopes that that comes along for her.
Mm-hmm.
Right?
Have you heard anything about genetic therapy?
Yeah, they're working on the gene therapies. They're scary. They're
Really?
Very scary, yeah.
they're scary and they cost a lot of money to get to clinical trials. And I know they're working really hard on it, the labs. But it has to
Scary
be safe.
side effects? Scary what?
Scary procedure.
I
Oh,
think that
really?
I think that it's scary because it's never been done. Like it's not really an active treatment yet. So to know if it's safe, to know if it's to know if it's going to work. I hope it does. I hope it does.
Keep
I know
praying.
they're working really hard on it, and I know
Keep
they're
praying that it
very
works.
confident that it will. So it's just a matter of getting it. I think getting it to market, and
Yeah, getting it approved.
I hope that happens.
It's going to be a struggle, but we'll see what happens.
And what that time frame is, right?
Right.
Yeah. We'll see.
Yeah.
Knowing the risk now, would you still have more kids?
Yeah, absolutely. I mean, it's a gamble knowing which way to go. I mean, there are, IVF options where they do genetic testing on embryos, so that's probably the route we'll go. Just because it's
To rule
easier.
out the Tay Sachs, they test the embryos before they.
They do simple
implant
gene
them.
testing on them, and
Yeah. Which. Okay. It's an option.
it's expensive, but it's an option, so it's probably what we'll do. Just emotionally, I think it's a lot easier
Yeah.
than,
Than the other options.
yeah.
Of like getting
Yeah.
pregnant, testing when you're halfway through, and then
Making that
deciding,
decision.
what to do. And
Yeah,
it's a tough decision, I think.
I think it is. Yeah.